Thank you. Thank you very much. And I want to welcome you to your state capitol, and I want to say how important it is to have folks like the previous speaker to come up and put a face on what we're doing in this session. Obviously, Texas has the largest percentage of uninsured people in the country. The Senate budget, with all due respect to my colleagues in the House, is considerably better than the House budget. But even in the Senate budget, we're still making some very draconian cuts in programs that impact our most vulnerable populations. You know, you ought to roll back and look at what we have done in Texas, at least during the 21 years that I've been here. Back in 2003, virtually every state in the country raised revenue. They raised taxes. Virtually every state other than a handful. And for those of you in the media who do the political fact check, I said a handful. You go out and count the number of states that did not raise revenue in 2003. Arguably, during better economic times. In Texas, the real tragedy is that during the best of economic times, we said, well, we can't do it now. We can't fund these programs now. And then during the worst of economic times, we come back and say, well, we clearly can't afford to do it now. At some point, we ought to be honest about what we're doing. We're really saying to our children, to our future leaders, we're saying we're just not going to address your needs. And that's why it's so important for you to be here for a Cover Texas Now Healthcare Advocacy Day on the steps of your state capitol. And I want to applaud you. Medicaid provider rates in Texas are already low, some of the lowest in the country. Those provider rate cuts alone will cause the state to lose another $2.2 billion in federal money. And if that happens, you know what our friends in New York and California are going to say? Thank God for Texas, because they're going to use that money. I want to applaud you for being here and standing up. You asked me to make a brief comment about the health exchange program. If we don't pass a health exchange bill in Texas, then we're going to leave it to the federal government to have to design one for us. And I want to encourage you to ask my colleagues in this building. If they are convinced that they're going to win the federal court challenge going on, okay, pass a healthcare exchange bill and just put language in saying it will go away if they win that federal lawsuit. But how could we not apply certain provisions of that federal health care bill that's going to make the quality of life so much better for people in Texas? I got a 23-year-old daughter, and I thank God every day that she is now on my insurance as opposed to going off now that she's out of college and trying to begin her own career. Who would not want a provision that says we're going to cover folks who have a pre-existing condition? And I want to encourage you to go to these offices and say, if you're convinced that you're going to win the federal lawsuit, fine. We can have a reasonable disagreement on that issue. But pass a bill that creates a health exchange program for Texans, designed by Texans, and add a provision that says if the federal government ends up losing that lawsuit, then it will go away. Last point that I want to make to you is that we ought to have a balanced approach to what we do in terms of passing our budget this go around. We ought to take some money out of the rainy day fund, but don't take it all out. And no responsible people are advocating that. But it ought to be a balanced approach. We ought to get rid of some of those loopholes. People who are getting tax breaks and have been getting tax breaks for so long, they can't even remember why they got the tax break. But that's a responsible way of balancing this budget and bringing in additional revenue. Thank you for coming. Sylvester, trying to thank you for letting me go up. I left my vote with one of my colleagues to show you how bipartisan I am. I left my vote with one of my Republican colleagues on the Senate floor. But I'm going to go back in case they vote the wrong way. Thank you very much and welcome to your state capitol.